All right, guys, we are going to work on scenario 2. So for scenario 2, we have Sandra here. Sandra here just got done with surgery yesterday. She had hip surgery. She had a hip replacement. So we're going to go ahead and help her move around, get up, stuff like that. Okay. So it says your charge nurse asked you to attend to Sandra in room 405. When you arrive, she has accidentally scooted down in the bed, putting pressure on the bottom of her feet. Assess her condition using the pain scale. Move the patient up, apply compression stockings, help her use the incentive spirometer, and assist her to ambulation with a walker. Okay, so we're going to do lots of different stuff with Sandra here today. I took the bottom of the bed off so that it was easier for you guys to kind of see what I'm doing, but we're going to imagine that it's still right down here and that it's putting pressure on her feet. So remember, that's how we get sores, like on the bottom of our toes. We can get sores like this pressure sore, this one on her heel here, because it's pushing on the bottom of the bed. So we just want to do our best to avoid that. So if we notice that she scooted down, we need to scoot her back up. So this one should be done as a 2-person. Obviously, I only have 1 person here, so I'm going to show you how I would do it. We're going to start by laying her down in the bed. So I'm going to say, hi, my name is Lindsay Schultz. I'm going to help you out today, Miss Sandra. You guys have any questions? How are you feeling today? How's your pain on a scale of 1 to 10? And don't forget, if we have kids, we need to use the pictures. Which smiley face do you feel like? Do you feel like a frowny face? Like stuff like that. Talk to them like they are children. Talk to them, not their parent, right? Okay, so because I'm standing over here, I'm going to pop both of our safety rails down. There would also be somebody on the other side who would pop those ones down, okay? The instructions for this one are on the back over here, moving a patient up in the bed, okay? So we make sure that we lock the bed, everything like that. Basically what we're gonna end up doing is we're gonna scoop here and we're gonna scoop underneath Sandra's thighs. If she does not have all these horrible sores and everything, we're gonna assume that she can help us out. So we're gonna say, okay, Miss Sandra, when I count to 3, we're gonna ask her to bend her knees, put her feet flat. When I count to 3, can you go ahead and scoot up in bed, okay? So I'm gonna be on this side here, and somebody's gonna be on the other side grabbing her the same exact way. And we're gonna say, okay, Sandra, 1, 2, 3. And we just do a little scoot up. We don't need to shove her against the headboard. We don't need to bonk her head on the wall, nothing like that, okay? All right. So we scooted her up in the bed so that she's away from the bottom here, and it's not gonna bother her. It's not gonna bother her feet, give her any pressure sores or anything like that. We're gonna help her first walk around, just because we need the anti-slip socks on her. Don't forget, again, we're just trying to avoid putting too much pressure on her feet. So when we do this, we're not gonna just shove it on her feet and pull it all the way up. We're gonna bunch it up and we're gonna slide it on like this. Okay, Miss Sandra, how you doing? You're doing okay. Okay, so we moved her up in her bed. We got her socks on her. We got her all ready to go. We're going to assist her to ambulation. So we need to put the gait belt on. Gait belt goes on your waist, right under your ribs. So we're going to say, this right here is your beautiful, lovely gait belt. Just so you know, on these mannequins, they don't like to stay in the right spot. You want it tight enough that it's going to stay, but not so tight that we're squeezing poor Miss Sandra, right? All right, so we got her all scooted up in bed, looking good. So I can still slide my hands underneath this belt, but it's tight enough that it's kind of gonna allow me to assist her if she were to fall or something like that, okay? All right, Sandra, we're gonna go ahead and hop up. I'm gonna go ahead and sit you up so it's a little easier to get rocking and rolling. Remember, she just had surgery, so she's probably in a fair bit of pain. We're gonna move slowly. If she says stop or anything like that, we're done, we're stopping, right? Okay, so we're gonna sit her up. You're doing a great job, Miss Sandra. The further up you can get her to sit in this bed, the easier it's going to be for her, the whole thing's sliding, the easier it's gonna actually be for her to physically rise. just because she's already almost at like a 90-degree angle, so it's going to be fairly easy to like push herself the rest of the way up, okay? So we're going to say, okay, Sandra, let's go ahead and slide you off the side of the bed. Normally she would help me do this, but obviously she can't really. So she's going to slide over. Can you sit up, please? Thank you, ma'am. So she's going to slide over here. Anytime Miss Sandra's moving, so this one is with a walker. It's hard to see, I know. Anytime we're moving them around, we're going to go at their pace. So anytime we're moving her around, we're going to go at their pace. If she gets here and she needs to stop for a minute because she's lightheaded or anything like that, that's fine. You're just going to allow her to do that. And then you're going to grab her hand. Go ahead and grab your walker, Miss Sandra. You're doing such a great job. Blah, blah, blah. And let me know if you need anything. At this point, we're going to grab behind here, and we're going to help her stand up. Okay, obviously Miss Sandra's not walking around or anything like that. We just want to make sure, like, you can't really see, my hip is up against Miss Sandra's hip. Okay, all right, don't ever actually throw a patient like that. Okay, so we did that. We got Miss Sandra up, we got her walking around, moving a little bit. Now we need to get her compression socks on, so we're going to take these guys off. All right. Now, the reason that we need compression stockings, it helps for a few different things. People who have diabetes, it helps them a lot. Just make sure that we're constantly getting the blood flow, but then also after surgery, it helps. Okay, so I have my stocking right side out like this. You're going to start by turning it partially inside out. So this right here is the heel, this like blue part, and you can see inside that there's like the place for her toes. We're going to put it on without sliding it over her skin, right? So I'm kind of like, I'm putting it on and I'm letting it go piece by piece so that I'm not pulling against anything, okay? So we're just going to slowly slide it on. I'm going to take small sections at a time and slide it over her foot. Again, you just don't want to create that friction that's going to cause her skin to rip, break, anything like that if it was sensitive or anything. Don't forget, our mannequins are kind of a pain in the butt because they like move around, like they don't have control over their joints. So just kind of do your best to put it on piece by piece like this. Don't forget, if they have like broken skin or something like that, you do need to wear gloves. Other than that, if they don't have broken skin and stuff, it's okay to do it without the gloves. Okay, so you can see like the open part here is going to be along the bottom of her foot like this. Okay, it provides like a little bit of relief because if you put pressure on that spot like all the time, it gets really sore. So we just kind of want to avoid that. Okay, so we did ambulation with a walker. We did the compression stockings. We moved her up in the bed. And then the last thing that we have is the incentive spirometer. So the incentive spirometer is this guy here. Incentive spirometers are used to help exercise like lungs and stuff like that, especially after surgery. So it looks like this here. This is the one, you put it in their mouth and you're going to direct them to breathe in. This is not a blow out. This is a breathe in, okay? So you would say, okay, go ahead and take a deep breath, and we want to get it. You can see that there's like a smiley face that we kind of want to keep it in the middle there. Okay, take a deep breath in, keep it in the smiley face. Go, go, go. Great job. Go ahead and let it out. And we're going to practice it a few times. And then normally they'll say like, I want you to do this twice an hour or something like that. And this is just to make sure that we're fully clearing like the lungs out. We're fully opening them up and everything like that. Okay. All right. So that is scenario 2. Miss Sandra, thank you so much. There you go.